Hello, welcome to Module 4 Body Mechanics for your WWCC Nursing Assistant NRST 1510 class. I'm Julie Levitt, RN, BSN. I'm one of the instructors for this course. Please, if you have any questions, contact your instructor for the course, and that is found under your course information. It's on your course information, on your syllabus, and also under contacts in your Blackboard. So, just some reminders quickly that this is Module 4. That means you have completed almost half of the assignments for this class. So please make sure that you have been caught up with all the other modules and assignments up to this point. At this time, you should almost have your grade in the grade book. That is found under Blackboard. Under Gradebook, it's on your front screen on the top left-hand corner. Make sure that if it is not a 75% or better, that you start taking better notes or maybe screenshotting, asking your instructor for some help. Please reach out to us. We are here to help you and make sure that you succeed in this class. Also, if you have not done so already, submit your vaccination and CPR. So we are halfway through, so that means clinical is almost here too. So we have to have those for you to attend clinical. Vaccinations are mandated at our clinical site, so you can't go unless if you don't have those. Also, if you have not started to think or have not purchased these yet, just want to start planning this in your ear, make sure you start looking around for black scrub pants, white scrub top, and or black and white shoes. So you can find most of the stuff at Walmart. If you live in Rock Springs, I know Wyoming Work Warehouse sells scrubs. If you don't want to spend a ton of money, sometimes you can find them over at Goodwill and the other thrift shops. You also can purchase them at Murdoch's. So there's lots of other places. I think I've heard Family Dollar sells them. So look around depending on your price range and what you want to use them for. A lot of people do end up using these later on when they're working. Other items you might want to purchase if you have not already, and they will just be helpful to you even when you work as a CNA, is a blood pressure cuff, a stethoscope, and a nice watch that you can wash. There's really cheap ones at Walmart. They're about $10. They have a washable band, and you can keep them on when you're washing your hands so much. But a watch with a second hand. Also, if you're traveling for lab and clinicals, remember that we are not responsible to provide you with food or housing for lab or clinical. Okay, so make those arrangements now while you're thinking about it. So Module 4 is on body mechanics. The subunits for this module are safety guidelines, moving patients, positioning patients, transferring patients in bed, transferring patients to toilet and vehicle, and module test. I'm going to click over and show you. Here's your Module 4, body mechanics. Here's your module, submodules. Okay. There's your units. So make sure that all of these little subunits are done to complete your submodules to complete the whole module. I know that hopefully you've gotten used to all this terminology. Here's the points for each module, submodule, and here is the total points for your module. Okay, so the first part of the module, the submodule called Safety Guidelines, they're just going to be going over how it is a physically demanding industry or profession to be a CNA. So make sure that you are taking care of yourself using the proper body mechanics. Body mechanics include good alignment, steady balance, squatting. Don't bend at your hips. You want to squat all the way down, bending at the knees. So I just put a little picture here of him actually squatting. And a reminder, ask for help. Don't think you're too good for help. Okay? Remember, if you have an injury, that puts you out of work. So you don't want to be out of work because you were too proud to ask. Okay? Widen your base of support. Bend your knees, tighten your stomach muscles, lift with your leg muscles, keeping your load close to your abdomen. Okay? Keep your back straight. Other ways to avoid injuries, really simple things to do. Eat nutritious meals. Just your basic proteins, vegetables. Try to avoid all those sweets which are out in the break room all the time when you're out there working. Try to avoid those. And if that's all you have, drink lots of water. Okay? Make sure you're getting great amount of rest and use your common sense, okay? This is just 5 questions to ask yourself while you're moving through the lessons in your module when you click in there. Because this is just an overview. Remember, all of your work will be done in Health Center 21. So click over there and get your work done. But these are basic questions you should ask yourself as you're going through this. Blank is moving and positioning the body in ways that prevent injury to oneself and to others. What is that? What is the most common injury to healthcare workers? When should good posture be used? How should one bend when lifting a heavy item? And how should a healthcare worker push an object? Okay, those questions will help you just stay alert and know what's going on in this lesson. So when you're moving a patient, that's the next submodule, pressure ulcers do occur, but we don't want them to. Okay, so we're going to prevent, because prevention is key to any illness, okay? So even with pressure ulcers, it's easier to prevent them than to treat them. So over here, I put a nice little picture. It just indicates all of our pressure points, okay? So that's good to already look at and kind of get a picture of that in our head, because that's where we want to relieve the pressure. So it causes pressure in the same spot for a long period of time. So if you were sitting in this wheelchair for hours and hours because you want to watch TV, or maybe the CNA got busy, that person's having pressure on the back and her sacrum and her bottom of her butt and under her knees and on her heels and her bottom of her feet. So look at all those areas right there that she's getting pressure on her. So you do want to go in and relieve that pressure. Okay? I'll show you other things to do for that. Pressure prevents circulation, so that means there's no circulation in those areas right at those moments. Okay? Or decreased circulation. Those bony areas are affected. Friction against the mattress or bed linens can occur. Shearing and moisture, dry skin or irritation from body fluid. So make sure that you're changing and cleaning up for this one, our client. This is just an overview of your pressure ulcers. Okay, so stage 1, it has not broken the skin. You just have a red mark to the skin. Okay, so you're looking over bony areas when you're repositioning them. Maybe you're taking them to the restroom. Maybe you're dressing them. CNAs have the most interaction with these patients while they're undressed. So you're looking at their skin at all times and making sure that you're making note, because prevention is key. So if you see a slight red mark, even when in doubt, report that to the nurse so we can do something about that. Okay? Stage 2 is when it finally has broken open. Okay, that top layer of skin has a crack or maybe a blister, or it's peeled, the skin is peeled over the wound. So just keep an eye on that. Stage 3, that is when a crater has started to appear. It's having damage, there's drainage, it's down to the subcutaneous fat layer. So just keep an eye on, report that. Stage 4 is all the way down to the muscle and bone, okay? So you will see a nasty tissue with that. Also report. I mean, every one of these stages you're reporting, even if you think the CNA before you reported, make sure you report to the nurse if it's getting better, worse, stay the same. It just shows that you're proactive for your patient's care. Other ways to prevent this when reporting is observe your patient, report changes, reposition, follow your turning schedule. Most facilities, I would say 100% of them, have a turning schedule in place, so know what procedure and policy that your facility has. Okay? Promote cleanliness, so if the resident has thrown up, you're changing the sheets, you're not covering it up. You're changing things. Maybe their gown got wet. Maybe they've been really sweaty and they just need a quick dry bath or something. So you want to keep them clean. Even when you're putting on lotion, you're dabbing off that extra moisture. You're going to decrease that skin pressure by putting pillows, ankle protectors, and getting creative. My mom used little stuffed animals after her surgery because she didn't like the big bulkiness of the pillow, so she used little bitty stuffed animals. I've seen the neck pillows used. I've seen, I just drew a blank, but I've seen a lot of different, the body pillows when people are pregnant. All of those can be used to prevent pressure. You want to separate those body parts. If you notice my little guy here, he has already 4 pillows to separate all his body parts. okay? Encourage fluids, rest, and range of motion. That just helps promote a nutritious meals. So you're getting the right amount of micronutrients and macronutrients and everything like that. You're drinking lots of water, and they are doing exercises to keep the circulation going. Making sure also that you're using transfer items like your draw sheets, your slip boards, and there's lots of other devices. When in bed, make sure that they're embedded and positioned correctly, okay, that their bony areas are not on top of each other, that they're using supportive devices. Know your positions, okay, hint, hint. I know that there's a question on the final about that, but know your positions. Supine, Fowlers, semi-Fowlers, prone, Sims, and lateral. I thought this was kind of funny at just different ways that we sleep in bed, so I thought that was a fun picture. Anyway, sitting, when they are sitting in a chair or a wheelchair or even in bed, that they have good alignment. Their feet are on the floor, that they're not dangling. They're using their foot rests, or I've seen even middle schools got placed in their room so they have their feet on those instead of dangling. Their back is all the way back to the chair or the wheelchair. If they are weak or paralyzed, that those areas are supported. Make sure if they are sitting up in a chair or a wheelchair that they're repositioned every 15 minutes. When transferring, you want to make sure that you know all the common transfers. So if you don't know them, ask. Remember, sometimes if you don't know everything or you forgot from the last time, you haven't done it in a long time, so ask. So know your common transfers, which is bed to wheelchair, bed to stretcher, wheelchair to toilet, and wheelchair to car. Okay? The Health Center 21 goes a little bit more into detail on the toilet and car area. But common guidelines for any transfers. Make sure you prepare yourself. Know what you're doing, how many people you're going to be meeting, inspect the equipment, and also to tell the patient what is going to be going on. During the procedure, you're going to be maintaining body mechanics for you and the patient, and you're going to be aware. That means of your surroundings, making sure you're not tripping over sheets and maybe a cord. So just know your surroundings, be aware. And focus. Again, explain the procedure throughout the whole thing. Like, Mrs. Smith, we are now going to pivot. 1, 2, 3. Mrs. Smith, we're going to sit down. 1, 2, 3. Okay? Explain the procedure as you go. It helps you and the patient not guess what's going next and prevents you guys from getting injured. Know your weaknesses. Observe the patient for changes and report those changes if they are occurring. Make sure you're always having safety on your brain, okay? Using brakes, non-skid socks, your slips, using shoes, anything that provides safety and helps you not injure yourself. If you're transferring a patient to a gurney or stretcher, you're using a 3 people minimum. The person with the heaviest part of the body is doing the counting. 1, 2, 3. Always using that system to initiate a transfer. Know what you're doing again and work as a team. If you're going to the toilet, maintain dignity. That is so important. So important when you're taking a patient or a resident to the restroom. So make sure you're maintaining dignity and use safety. Okay? That is a quick overview of the basic body mechanics that you're going to be learning and information that you're going to be learning in Health Center 21. I did this just as an overview, so when you're studying or maybe you just like the pictures or it helps you in any way, please let me know if you have any questions. We will be doing a lot of the transfers, and also if you have questions, write them down so we can ask and go over them in lab. Okay? Have a great day and enjoy this module.